Yeah, so we started the Heroin Task Force with the first objective is to take advantage of real-time data. You know, for years in this epidemic, we had no good, consistent data that was timely. And it's hard to fight a problem if you don't quite understand what's going on in the last few hours, let alone the last 24 hours. So the first thing is we put together a large group of manpower to adapt to the ongoing trends in this opioid epidemic, what's occurring in the last 24 hours, where's the ODs occurring, what type of bags are being sold, what lives are being lost, and be able to respond to it with a sufficient amount of manpower. So that was the first objective, make sure we had dedicated manpower to respond to the timely intelligence. The second part is, the media asked me right after we started the Heroin Task Force so what's the objective? And really it's hard to define the objective when we really couldn't define the problem for years and years. We didn't have real-time information, real-time data. So our first objective was to slow down the number of red dots on our map. The red dots are death. And they were occurring at such a rate that whatever we could do to curtail that was loss of life. That was the most immediate concern. Can we slow them numbers down, the numbers of deaths being created in Monroe County? And then, the third objective was to get our hands around this problem, if you will, cordon off the problem, understand what's occurring, and see if we can at least slow down the overall expansion of this problem. The numbers of ODs across America, let alone here in Monroe County, we're going at about a 45-degree angle. If you look at a bar chart for the last 10 years, so our third objective is, hey, can we just stabilize this thing? Can we get our hands around it and see if we can control it? And then maybe we can get into the middle of it and solve it. So those were really the first three objectives, if you will, to make sure we had sufficient manpower with real-time data to slow down the number of deaths and maybe stabilize the overall catastrophe that was occurring right in front of us, and that would be the number of overdoses.
When did you start that?
Started the Heroin Task Force February 1st of last year. I had campaigned on the whole, we got to put resources and time and energy and money into the opioid epidemic. So, it was one of the first objectives we did when I became sheriff, is sitting down with Sandra Dorley and the DA and looking what she already implemented, and look at our other stakeholders in the community, and let's get people on the same sheet of music as much as possible and synergize our efforts going forward. Well, that's a double-edged sword. I never wanted to claim success when you got 195 deaths last year. In the year before we had 220 deaths, and the year before that 169 deaths, and those add up real quick. And these are human souls. So I'm very cautious about saying success. But the fact is, we are now, if you will look across the community, and it's not just because of what we did, but I think everybody's talking the talk now. Everybody's engaged. More people are starting to understand this is an epidemic that will touch any one of us at a moment's notice, and that's successful. That people are starting to understand that pin map, and that this is happening everywhere, every demographic, every economic, social part of our community is being touched by this. So that's one of the things I think we can claim success, is that we're really pushing the message out that this is an epidemic that touches everybody or could touch everybody. So, be prepared. So we're definitely seeing more Narcan being deployed in our community, with the education process going out there, telling people why they should carry Narcan, letting restaurants and other public locations understand why they should have Narcan on hand. The ability to get Narcan out into the community easier. When it first became available, Narcan was, we all had to sit through a special class, even police officers, and now you can get it at a 20-minute class with a nonprofit, and they can hand you Narcan on the way out the door. So it's becoming much more prolific in our community, which is a good thing. With that being said, there's a lot of anecdotal information out there about Narcan right now, because it's a very hard number to track. We could probably tell you how many Narcan units have been distributed, but it's really hard, like your question said earlier, it's really hard to measure how many are being used. It might be, one Narcan administered to bring someone in an overdose back. It might be 4. A lot of Narcan being issued might not be reported to anybody, because so many people have it in the community. They just Narcan and revive someone and move on and never call the police or call an ambulance. So it's a very difficult measurement that we're finding. Of all our measurements we do, Narcan issuing or distributing Narcan and who's administering, it's a very elusive number to look at.
Dr. Mendoza, where you get that out?
Yeah.
The word out?
So I would like to see Narcan, 100% available to everybody. We don't find the abuse in Narcan. It's not like other prescription drugs that you could be abused. We're not seeing that abuse out there by any means. And it's like the defibrillator for heart disease. We'd be crazy to go in any public building right now and not see a defibrillator available. Same thing in the middle of the biggest crisis of our lifetime. It's the biggest health crisis of our lifetime, why not have the number one miracle out there available to everybody? Yeah, so Project Hope was, we stole that, if you will, a great idea from Staten Island, and the district attorney down there has a process for police officers that come upon a person that might be violating New York State penal law with a low-level possession charge of a narcotics, but they're truly addicts that are feeding their addiction. And short of any other criminal activity, maybe we can divert those people, as opposed to an arrest, divert them into a treatment plan and get them the help they need and get them out of the addictive state or the cycle of addiction. So Project Hope was designed for first-line caretakers, if you will. At this time, a police officer arresting someone that's an addict and they're in the backseat of the car, maybe to divert them into out of the criminal justice system and into a treatment plan. So the idea is now that we have, as opposed to a carrot, we have a stick hanging over their head, arrest and prosecution, that maybe that'll encourage them to go through a recovery process as opposed to a criminal justice process. So that's really what the Hope was designed around. You know, can we get people that now we have them in the backseat of a police car, maybe at the lowest low of their lives. They're looking at embarrassment, they're looking at incarceration, they're looking at prosecution. Maybe this is the time they make the decision that I'll take that step towards recovery. Yeah, so you know, one of the objectives of our heroin task force is to look at people that are selling heroin, fentanyl, cocaine now laced with fentanyl, all these concoctions. If they're selling that in the streets of Rochester, County, and Monroe, we want to make sure we have sufficient resources to go at them full bore. There's no way we should allow anybody to walk around the streets of Monroe County and selling what we call poison that's killing 160, 70, 80 of our citizens every year. You know, so you know, we're going at the dealer full bore. We've put in what we call a surge of manpower into the enforcement end of it. And as another example, you know, just a couple short years ago, everybody that was arrested in relation to a death, no one was ever charged with a homicide-related charge. Now, last year, I believe we prosecuted 8 people. When the assistance of the district attorney, you know, we're able to put 8 people behind bars for homicide-related charges, not just sale or drug possession charges, but actually holding them accountable for taking someone else's life.
Yeah.
To prosecute someone for selling narcotics that takes someone else's life is a very difficult prosecution. You know, it's not a black and white case, so you have to establish a lot of investigative information behind that. So, you know, the chances of us making a homicide charge on someone that sold one bag to someone else and it took someone else's life, that's although I, you know, personally as a police officer, I still find that to be a grievous act. You know, there's nowhere out there in this community that they don't realize selling heroin to another person is playing Russian roulette with that other person's life. We don't know what's in that bag. No one does. It's not scientific. It's not ADA approved. You know, that's any one of those bags could be dirty dope, and everybody in that trade or everybody in that field knows that. You know, so. But the likelihood of us charging that person that sold one bag accidentally to another person for a homicide charge is really nil. We have to put a whole case package together in this, and we're looking for intent. We're looking for the culpability that goes with that. You know, it can't just be a accidental dirty bag. We're never going to get a prosecution, let alone a successful conviction out of that. So there's a whole lot of background work that goes into that, and we need to show the intent over long term that they were playing Russian roulette, that they knew they were selling dirty dope, or they were selling hot dope, or they were selling the good stuff, you know, that actually ended up taking someone else's life. I think as this epidemic continues to roll out, you're going to see other legislation come forward to not only prosecute people that are responsible for taking other people's lives, but also on the other side, I see family members all the time in desperation. You know, they see their loved ones spiraling out of control to the point that they'll call us and say, please arrest my son. At least I'll be in the medical assisted therapy wing at the Monroe County Jail and as secure and safe as possible. They're just trying to let their loved ones live. And, you know, so I see, you know, our legislators picking up and at least having conversations about that type of legislation that will allow, you know, medical professionals and professionals in the community maybe even take someone into custody for their own good and put them into a treatment plan. You know, as this thing spirals, and we hope it's stabilized here in Monroe County, we hope it stabilizes across the United States, but sooner or later we're going to have to do something, you know, maybe that next overt step, and that's a very overt step. Those laws, you know, those are very, very overt. You're taking people's civil liberties, you're taking their freedoms. They can be an addict and be an American citizen at the same time. You know, they still got the Constitution. So those are very high risk, you know, conversations to have. But, you know, every once in a while we see that case that, man, we know if we don't get our arms around this person and secure them, they're dead tomorrow. And it'd be nice to have a tool with a whole lot of checks and balances systems in there to protect their civil liberties. But every once in a while you see that case that I know if I let this person walk away, they're dead. And God forbid that we don't have a tool that allows us maybe just to detain them for another 24, 48 hours at least until we get them some kind of stabilization plan. Yeah, the thought process of an addict, is disrupted, right? We all agree on that. The thought process of an addict that's addicted to heroin or fentanyl or an opioid-related substance is even more distorted. There's no doubt. And I use the analogy all the time as oxygen. When I'm trying to talk to people and explain to them this thing, these people are seeking their next breath of oxygen. And if you hold their head underwater for 45 seconds, they'll probably do some crazy stuff to breathe one more time. And then you hold it for a minute and a half. They might even steal from their mother. They might even leave their kids abandoned for the sake of coming back because they'll live. And that's how they're mentally processed. If I just go get breath one more time, air one more time, oxygen one more time, I'll be here tomorrow to take care of my kids. This is the process they're going through. So to put our norms on top of their decision making really doesn't make sense sometimes. I mean, these folks are addicted they're beyond cocaine, they're beyond nicotine, they're beyond alcohol and all these other addictive substances. They are not thinking rationally at that time, and if you start thinking like that, you can start understanding why they're making decisions that would be contrary to all our norms.
Yeah.
Well, first of all, it's a personal decision. There's no doubt in my mind. They have to be at that point in their life where they're going to, first step is to admit you got a problem, right? We've been saying that for years and years, and this one is another example. That the first step is you got to be at that point in your life where you're willing. The second point there is as soon as you make that decision, we got to make sure we got the supportive services here in our community. Project Hope might be one, inpatient beds might be another. The Monroe County Jail at that moment might be the right step for you, where you can be forced to be sober for the next 24, 48 hours as you go through the detox process. But the point is, once they make that decision, we got to make sure we have all the facilities, all the doors are open, because you need the path of least resistance at that point to help these people out. And then, the most difficult part is long-term recovery. These folks are going to be fighting this battle, this monster, for the rest of their lives. They can go through a 30-day inpatient bed. They're not done. They're fighting for the rest of their life. This monster is going to be on their back forever, and we got to make sure we got the supportive services out there to continue to help them keep that road to sobriety as long as possible. Like if we knew exactly what was causing, the first step of any problem-solving model, any problem-solving model you look at, is truly identify the problem, right? What's really causing the problem? And in this one, if we truly knew what was causing the opioid epidemic, we'd be able to solve it much easier. But there's so many things that are attributed to this: social economic issues, right? The breakdown of families, the opioids push through our medical doctors and prescription drugs, the mental state of our community. If you look at suicide rates in 2015, we had the highest recorded number of suicides in America in 2015. In 2016, the very next year, we had the highest recorded ever overdose deaths in America. There's got to be correlation between our mental health and this addiction state, and how many of those suicides are actually overdoses and vice versa, right? So I think we got a whole perfect storm working here in front of us. And there's no doubt that the proliferation of the prescribed opioids had a big impact on this, but there was many other things that were occurring at the same time. So perfect storm, I guess, is what you saw. We've had the loss of hundreds and hundreds of Monroe County residents in the last few years, right? And if this was the flu, if this was an active shooter, if this was the Mount Morris Dam flooded and broke and washed out half of Rochester, there would be command posts set up. There'd be someone in charge. We'd be looking at someone every day, and that person would synergize or choreograph the play every day. You guys got to do a little more of this. What are you guys doing in recovery? What are we doing with education? How are we doing in enforcement? That frustrates me still to this day, that there's no one's taken ownership of this problem and said, this is my problem, I'm in charge. Not to do everybody else's job or tell us else what to do, but to choreograph the play, to synergize us all together. If there's anything we can do better, it's more synergy, it's more choreographing the play, it's more identifying resources and not being repetitive or not being egotistical or not being placed in our silos. And none of them are doing, I don't think anybody's doing that intentionally. I think we got the goodwill going forward. We got the synergy, like I said earlier. But still to this point, who's in charge? Who's really in charge? I don't think a lot of people want to take ownership of the biggest epidemic of our lifetime, and a lot of people don't want to take ownership of something that's going to continue to look bad for years and years to come before we recover out of this. So that's one thing I think we should do as a society, as organizations, as government, is truly say, put money where your mouth is, put effort and time, and put people in charge and say, I am now in charge of the opiate epidemic in this sphere of influence, and I'm going to try and build all these players together into one cohesive team. Not telling us what to do, but to synergize all those efforts.
Yeah.
Well, again, biggest epidemic of our lifetime. One of the things that I would like to see passed or more solutions is a total 100% full frontal attack on prevention. And we have hundreds of people dying. We got recovery beds overflowing. We got wonderful nonprofits out there working in the recovery world. This is like an oil fire, right? And an oil well. If we don't clamp off the source of the oil, we can put as much water on that thing as we want. We're never going to shut this thing off. And so it all comes back to that prevention. We've all seen the commercials on TV where we got to watch the guy suffering from cancer, and disturb us when we listen to him talk and have his face missing. But yeah, it makes us think twice before we put tobacco on our lips or smoke a cigarette, right? We remember back in the AIDS and HIV epidemic where it was someone else's problem until we all realized this is a health issue and stop stereotyping people. We finally got our hands around that, right? So the answer to the question is, what can we do more of? We should be on a full frontal attack on prevention, education, prevention messaging, outreach centers, talking to people, going deeper into the schools, deeper into the PTAs, VFWs, American Legion Post, parent-teacher associations, any place we can get in front of a public, we should be talking about this because it's touching. If you look at the map, it's touching everybody, and we're not doing quite as well as we should be, I think, on the prevention of this thing, and we'll never catch up until we prevent. Last year we made 98 arrests. Just with this one portion of the heroin task force, we made 98 arrests here in Monroe County. We took over $1 million of it will seized money or the equivalent out of the drug dealer's hands of the equivalent of product. We're knocking down the doors, a couple times a week sometimes of drug dealers' houses. But there's always going to be that principle of economics called supply and demand, right? And as long as there's demand, they'll be willing someone to go through a supply chain all the way through, different countries into Rochester, New York, into Pittsburgh, New York, and there's going to be someone willing to supply that and willing to risk maybe even death or jail. So if we don't get really serious about prevention and preventing the next few addicts from occurring, we're never going to catch up to this epidemic. Here's another great example of that. I've talked to parents in the suburbs that have a kid that's stuck in the addictive state, and because the kid is either a great manipulator, because most of these folks are in that state of mind, or they feel so sorry and think their kid's going to die if they don't get that next fix. I've talked to parents, good parents, driving their kids down to where their heroin is so they can get one more fix. And then maybe, think about that. And if we just educated people, if the medical staff would educate people, I can't find one documented case that anybody's ever passed away going through the withdrawal process. It's hell, right? No one wants to. It's hell on earth. But the fact is, if you can get them into that state and get them over that hump, right? But I'm a mother and I'm watching my kid, and I truly believe my kid's going to die if they don't get another fix. I'm even thinking beyond norms and driving them to where they get their next fix. I think they're going to die if they don't. And you're just trying to hang on to your dear loved one, your baby, for 24 more hours. That's all they're thinking about. Can I have this kid survive? And we haven't even educated the public well enough to understand what the withdrawal process truly is in this process. And again, I'm not a medical doctor, so I'm not trying to give medical advice here, but it'd be nice if medical folks were out there truly explaining what the recovery looks like, and that starts with the withdrawal process. And there might be other complications taking people's life, but I can't tell you, people withdraw inside the Monroe County Jail all the time. We have medical staff there monitoring them and protecting them, but the fact is we never had anybody pass away from the withdrawal process. It's hell, yeah. But it usually doesn't take some. But we don't even talk like that. We don't talk open and frank and share that information with people.
Yeah.
So we can get more beds open by, number one, being honest and transparent with where the beds are, what the beds look like. We have debates at meetings now about are those inpatient beds, temporary inpatient beds, 30-day inpatient beds, and in our meetings we're confusing each other. And then if you're someone that has a loved one, the average age of death last year in Monroe County was 35 years old. So maybe you're a kid or a mother of that 35-year-old person that's just on the verge of passing away. The last thing you want to do is have a debate of where the open bed is. If you have that loved one willing to make that decision, like we said earlier, they're at that breaking point, you should be able to go online, pick up a phone or whatever and say, I'm ready, where can I find an inpatient bed right now? So one of the first things we do is where's the list of inpatient beds? How many are there? What's the capacity? Is a certain place full but another place is open, has an open bed? Will it be open tomorrow morning at 8? in the middle of the biggest epidemic of our lives, we still can't even give you that information. I have police officers that have to make multiple phone calls and then drive them. Sometimes I just had one of my deputies drive someone out of Monroe County the other day to get them into an inpatient bed. So, we're constantly having this debate about beds. One of the first things we got to do is index. Where are the beds? How many beds are there? And what's the path of least resistance to get someone at that breaking point into one of those beds? So, again, outside my bailiwick, outside of my job description, but I do know I have a deputy just the other day that he's telling me I'm on the way to another county, and that shouldn't be in the middle of this epidemic,
Was that from Project Hope?
No, that wasn't a Project Hope case. That was one of my deputies. So in our task force that we put together, we obviously surged the narcotics enforcement folks, but we also brought a crime prevention officer over to the heroin task force, and his full-time job is to look at those dots, look at that map every day, and identify families that he can now go and intervene. If they were successfully didn't pass away, if you will, during a narcotics overdose, his job is to go out and intervene with that family the next day and see what he can provide as far as resources. And then also, he's received, for instance, multiple times this happened, where he receives a Facebook message from a family member saying, my son is in a hospital or in a house in Brockport. He won't come out. The drug dealers won't let him out, but he wants to get out and he wants help. Well, this deputy, Mike Favada, drives over to Brockport in this specific incident and knocks on the door, uses his will with the uniform and gets the kid in the back seat of his car and drives him to an inpatient bed. Those are the things that we're trying to do to save lives, right? To slow down those number of red dots. We know if we leave that kid in that drug house, he's just going to keep on spiraling until he gets that bad batch of dope and end up somewhere. So, those are things we got to do more of. And I think the answer to your question is, how many beds are needed? I've yet to see the survey, of a professional is doing a research project on that, like you would do with any other epidemic. I'd like to see, inpatient beds available now. One of my police officers at 3 o'clock in the morning could tell you that Rochester General has no room at the emergency room, right? They're full. They're code black or code red, so we take people to another hospital, right? We don't go to the wrong hospital 3 times till we find out where you need to be in an emergency, but we're still kind of doing that with opioids, in epidemics like this. It's dumbfounding. And again, it goes back to what I said earlier. Who's choreographing this whole play, right? Who's putting this whole piece together? Because I'm law enforcement. I'd love to do that, but I have a full-time job, right? And I got my job's enforcement and education. That's how I look at and assist with recovery through Project Hope. But there's really no one in our community that's really put all this together. You said drug dispatcher. I keep on saying drug czar, which no one likes, yeah. But because czar has a negative term, but drug dispatcher. I mean, the opioid, just the coordinator. Who's coordinating on behalf of all of us? And again, we got small nonprofits. They don't need to be told what to do. We just need to inventory what they're doing, so we can say, they're doing a lot of that, and this nonprofit is doing the same thing. What if you do a little of this and you do a little of that, and put the two together so we're not being redundant, right? It should be on everybody's smartphone right now, right? I should be able to pull up an app and where's an open bed right now. God forbid you got a family member suffering through this addiction. You watch them spiral out of control and they finally say, Mom, I'm done, I need help. Yeah, it should be there should be no resistance to that at the moment. Exactly. One of the things I've seen Mayor Warren do is trying to work on the Clinton Avenue corridor. She's had meetings with myself, what can we do more down there? As far as the sheriff's office, working with her police department in there. I'm not too sure what she's done with the local nonprofits or the community groups down there. I wouldn't know that, but that's like a ground zero in the middle of the city of Rochester. As you went down there with Hope Dealers, you saw that. And again, that's not a bad neighborhood. That's just where ground zero happens to be, and it goes back to supply and demand, right? And that's going to continue to fester to be the ground zero of our area until we do something very drastic. One of the things I'd love to see, and I offered this to the mayor, is if you want sheriff's deputies down there, just ask for them. Those people are Monroe County residents also, not just City of Rochester residents. So, we love to work deeper with the City of Rochester and put more of our resources, whether it's uniforms with overt or undercover police officers in those areas, and because that's truly where the epidemic is happening. The overdoses are occurring everywhere, right? But we know by the map where ground zero is, and anything we can do to assist, we're here as a sheriff's office. Yeah, the whole corridor down there, right? But you look at the maps, and the maps we shared with you, that might be ground zero, and that's because of supply and demand. That's because that's where it's easiest to get the dope, right? That's where it's most prolific, and you can see. But as you can see by the needle program down there, people just can't wait to take that dope and head back to Pittsford or head back to Webster. But as you look at the map where we indicate where the overdoses occurred, a lot of people are getting their fix there and making it back. And you can see on the map, you can see the 390 corridor, heading out. You can see the 104 corridors heading out of Monroe County. You can see the stop and rides, on the side of these expressways, because that's where people are stopping to get their next fix and trying to make it home, and that's where they're overdosing. So, again, it's not a city of Rochester problem as much as it is that's where the ground zero is occurring. Yeah, so the needle exchange program started years ago for the transmittal or slow down the transmittal of infectious diseases between needle users, and when I was a young cop working in the city of Rochester, we used to charge people with a misdemeanor. Criminal possession of a hypodermic instrument, and then the laws got changed, and then you've seen the pile up as you see now of needles being piled up along street corners and underneath bridges and in backyards of abandoned houses, so it may have done a cause, and one of the causes was to slow down the infectious disease. But the other side is we've seen the proliferation again of needles. Needles are just piling up, which again may have diseases and be in contact with other people that are not even using the needles. So it's that double-edged sword that we saw, a good idea, but if we really thought about how we're going to police this thing and how we're going to control it. So, the answer to the question is it a good idea? It's a good idea from infectious diseases and trying to slow down the number of diseases being transmitted, but you've caused a plague on other parts of the community, where we're now picking up thousands a week, and just trying to keep an area halfway clean. But thousands of needles in a certain neighborhood being picked up a week is an incredible problem.
How are we doing with time?
Good. You want to cut real quick and just restart?
Yeah.
Because we're up to
All right,
30.
we can only record for like 20 minutes.
Okay, yeah.
So we have to stop and restart it.
Well, I would talk to anybody that's an active addiction. We don't know how you got there. We don't know why you're here. It's not time to make a judgment call. The fact is, get help, right? And your local police officer anywhere in Monroe County, any police department's been trained to understand that you're going through an addictive state, and we don't want to be the bad guy in that story at that time of your life. You can call 911, and police officers will come with the sake of serving and restorative type of work as opposed to punitive and law enforcement at that time. There's if you don't trust law enforcement, you don't trust government, which is very understandable when you're in that state of your life. There are wonderful nonprofits out there that will ask no questions, and there's SOARs, there's Recovery, we can just go on all the YWCA, the YMCA, all these wonderful nonprofits all are engaged in the addictive cycle right now. They all understand what people are going through, and they have resources or at least the capacity to get you into the right place. So that moment you want help is the moment you should not fear law enforcement or fear calling 911 and saying I need help. Everybody in Monroe County has been trained and understands, and the paradigm for us has changed over the last couple of years to be more supportive, restorative, as opposed to punitive, that someone's stuck in the addictive cycle.
Well,
Any parent out there that has a family member stuck in the addictive cycle, and again, it might not just be a parent, it might be the parent, with the average age of death being 35 years old in Monroe County, again, there's people out here willing to support you. There's people out here that have gone through the same thing you're going through right now, and they're motivated. They're designed to come and help you in that state. So if you think about the mother of an 18-year-old that's stuck on opioids and is an addict, I can tell you names of mothers right now that have gone and sat in the same seat you sat in years ago, and they're the best people to help mentor and guide you through this next couple months of your life. I can only imagine it's a living hell. It's everybody's fear, that's for sure. And with that being said, there's people out there that allow us to contact you with those people that have gone through the same thing you've gone through and let them walk you through this process. There's no one better to do it.
Mother or father who has just lost their child to addiction.
First of all, we say it all the time. When we look at these maps throughout Monroe County, when we look at the maps, we think of those dots. Each one of those dots we can click on and it pulls up a name. It's not just a dot on a map. It's a human soul, and that's how I could not express my condolences enough. No one raises their kid to become addicted. No one raises their kid to lose their kid to something so horrific as this, to an epidemic that's unfolding right in front of us. And I would not blame them if they're a little pissed off at the world, you know. And the fact is, we've watched this thing grow for 10 years. And if they weren't warned, if they weren't, told of how scary this thing is, and it's right behind each one of us. Every community member here in our community should be aware that it's right behind us. It's knocking at our door. Our condolences to anybody that's lost someone. Our heartfelt frustration with them that there's not more that we can do or should have been doing or should be doing right now. And the fact is, I think you're seeing everybody starting to come around now and say, you know what, this is not someone else's problem. These are good people that we're losing here, and we need to start thinking about that. They didn't lose a person that was an addict. They lost a son or daughter, and we got to look at it like that. They lost a human soul that was precious to them.
What would you say to some?
Well, I think it's very clear. If you go downstairs in our building, you'll see signs all over our building, and it says, if you're selling dope on the streets of Monroe County, we're coming for you. And we're quite frank about that. We put a surge into our narcotics task force. We've paired up with the Rochester Police Department. We've paired up with the Gates Police Department, the Brockport Police Department. We paired up with the New York State Police, district attorneys, and we've put in our money, or in other words, our resources, the number of police officers into this. We're coming for you. And we don't say that to be vogue. We don't say that to be rogue. We don't say that to be antagonistic. But you are selling dirty dope that's killing other people, and we cannot tolerate that. And then for the people that are stuck in the addictive state, we've said it before, we're here for you. We understand that you're not trying to commit criminal intent. You're trying to survive. And if we get you in the backseat of a police car with handcuffs, we are now looking at you. Can we do other things with you besides just put you inside the Monroe County Jail? Are there other ways we can get you into treatment? But for those people selling dirty dope, I have no tolerance. I have no sympathy for them. They are playing Russian roulette with other people's lives and making a profit off it, and that's called murder in my world. And we've got the resources. We made 98 arrests last year. We're going to keep on making 98 arrests. We're going to take millions of dollars out of your pockets. We're going to take your dope away from you. We're going to try and put you away. So, do we see it slowing down? Objective number one, and I talk about the dots all the time. Our objective number one was, can we decrease the number of red dots, right? And the red dots on this map are death. And this is an 18-month map, our first 18 months of the Heroin Task Force. But even during this effort we're putting forward, these are still how many dots occurred throughout Monroe County. So with that being said, if you look at the bar charts and you start charting these things out, you can see just overdoses in Monroe County during this 18-month process. Still staying up on the 45-degree trend almost, but if you put a trend line on these things, you can see the trend line starting to stabilize, and in the last few months of last year and the first few months of this year, we actually had a downward trend of overdoses in Monroe County, which is promising. Our first job was to decrease the number of red dots and then to stabilize this situation. The last 2 months of this year, we've had a slight increase again, and we think that's probably going to go up this current month too. And we're looking at that every morning. Why are the numbers going up? Why are the numbers going back up? But overdoses are going down. And if you look at overdoses, I believe this is fatal overdoses, again, kind of following the same trend line. But if you put a trend line on there, you're going to see a slight decrease over the last 18 months. And again, before it was going up at a 45-degree angle, but now we're seeing a slight decrease when you trend line this stuff out. The one that's really surprising, and not surprising, but you look at the number of deaths going down, and then you look at the Narcan use. This is the education. This is the getting Narcan in every business. This is getting Narcan in everybody's hands. Or the question you guys asked earlier, is it a good idea to get Narcan in every community members without a prescription? I think this chart shows you that if we can increase the number of Narcans being administered, we're probably going to have a good cause and effect on the number of deaths occurring. Not the number of overdoses, but maybe the number of deaths that are occurring. And if that's one of our objectives, that's not a bad thing. Some people are arguing, there's a county downstate that said they wanted to put a 3-strike rule on Narcans. If you got Narcan 3 times, we won't Narcan you anymore because we're only feeding your problem. I don't know who plays God in that situation. I definitely can't. If that's my nephew and God forbid he made his fourth mistake, I'm probably not going to just look at him and let him pass away. I'm probably going to Narcan him, you know. So easy said, pretty rogue, tough words, until the person's dying at your feet. Then you probably administer a Narcan if you had it. Why wouldn't you? And let someone else figure out why this person keeps on cycling through the addictive cycle.
You want to zoom back up? Good.
Yeah, one of the things at the Monroe County Sheriff's Office, you know, we've obviously done the heroin task force. We've put a surge in the enforcement. We have our crime prevention officer now reassigned to do nothing but the education and the recovery part of this, and work with the families, driving people sometimes out of state, out of county, to beds if we have to, whatever it takes to help that one person. But one of the other things that we started here at the Sheriff's Office is inside the jail, we actually started a medical assisted therapy wing, where now we have people that are screened inside the Monroe County Jail. If they're in an addictive state, we have now brought, if you will, this is a tough sell and a culture change, we now bring drugs into the jail, and they're medically prescribed drugs with doctors prescribing them. But as people are going through that addictive state in the jail, they can now start their medical assisted therapy inside. And now when they're leaving the jail, they continue on with the same programs. We don't leave them dry, if you will, as they walk out the jail. We can continue their prescriptions and continue their therapy even as they're leaving the jail. So we're pretty proud of that, we talk in our community about 30-day inpatient beds, and that's kind of the gold standard. If I can just get my loved one in a 30-day inpatient bed, we know that's only scratching the surface, and they got the rest of their life to fight that battle, that monster. But I always say I have 90-day inpatient beds. I have 180-day inpatient beds. You know, if you've been sentenced by a judge for how many days, I now can make you the inpatient bed that your family's been dreaming of. I have you in custody and an inpatient bed. So my challenge to my staff is make the Betty Ford Clinic of addiction inside the Monroe County Jail, because we got what everybody else dreams of. We got them in custody, which is a great benefit.